Did you know that there are medications that can reduce the risk of breast cancer in women who do not have breast cancer but at higher risks? Did you also know that breast cancer survival rates have increased tremendously and the number of people dying from breast cancer is steadily decreasing? My name is still Annie, your friendly health coach. Welcome back to my platform. In today's video, we are going to look at the symptoms of breast cancer, the causes, the risk factors, and how to prevent it. Please take a seat and do not leave until this video is over. There are many people who think of breast cancer as a women's issue, but breast cancer does not only occur in women. Anyone who is born with some breast tissue can get it, but women are much more likely to get breast cancer than men. 99% of breast cancer cases occur in women and 0.5 to 1% of breast cancer cases occur in men. It is important that you know what your breast normally look and feel like so that you can notice changes in your breast. When someone has breast cancer, the most common symptoms are pain in the breast or nipple, changes in the shape of the nipple, a swelling or lump around the collarbone or under the arm, a new lump that does not go away after the next period, a discharge from a nipple that is clear, red, brown, or yellow, and unexplained redness, swelling, skin irritation, itching or rash on the breast. Please note, if you have a lump in your breast that is hard and has irregular edges, I don't want to scare you, but it is more likely to be cancerous. But if you have one or more of these symptoms, it doesn't necessarily mean you have breast cancer. Sometimes nipple discharge can also be caused by an infection. Do you know what causes breast cancer? The causes of breast cancer are not known, but there are many risk factors for these cancers. For example, a normal breast cell can become cancerous due to changes or mutations in the genes. Hormones also seem to play a role in many cases of breast cancer. But again, why this happens cannot be explained or understood. There are also some risk factors that increase the risk of breast cancer. The presence of a risk factor does not mean that you will get a disease, and not all risk factors have the same effect. Most women have some risk factors, but they do not get breast cancer. Talk to your doctor about how to reduce your risks and how to get screened for breast cancer. One risk factor is your family history of breast cancer. But it is interesting to know that most women who are diagnosed with breast cancer have known family history of the disease. So if breast cancer runs in your family, it does not necessarily mean that you will get it. Another risk factor is certain genetic mutations that greatly increase the risk of breast cancer, such as BRCA1 and BRCA2. The risk of developing breast cancer is higher in women of white background than in Asian, Hispanic, and Black women. However, Black women have a higher risk of developing more aggressive advanced stage breast cancer that is diagnosed at a young age. Women with dense breasts have a higher risk of developing breast cancer because tumors are sometimes difficult to detect on a mammogram. Women who had their first period before the age of 12 also have a higher risk of developing breast cancer later in life. Another risk factor is that some women have already been exposed to their daughters during their mother's pregnancies, which causes them to grow up later develop breast cancer. Another risk factor is that taking certain hormone medications to combat menopausal symptoms can increase the risk of breast cancer. People who are overweight also have a higher risk of developing breast cancer. Another risk factor is that your risk of breast cancer is higher if you receive radiation treatment to the breast as a child or young adult. Some risk factors include women with low vitamin D levels, women who are exposed to high levels of air pollution from fine particles such as dust, dirt, and smoke. If you're also exposed to hair dyes and hair straighteners. Another factor is that women who enter the menopause at an older age, for example after 53, have an increased risk of breast cancer. Another risk factor is you have taken a contraceptive pill in the last 10 years. Drinking alcohol increases the risk of breast cancer. Lack of exercise, smoking. The risk of breast cancer increases if you have first child after the age of 30 or if you have never been pregnant. If you have been pregnant once or several times, the risk of breast cancer decreases. Your risk of breast cancer increases if you work the night shift and your body is exposed to bright light all the time, which decreases the amount of melatonin in your body. Another factor is that you have a higher risk of developing breast cancer again if you have already had breast cancer in the past. In case you are wondering if breast cancer can be prevented, the answer is no. But there are many things you can do to reduce your risk of breast cancer. Number 1, maintain a regular self-exams to check for abnormalities in your breast and get screened. Mammograms can help detect breast cancer at an early stage when it is easier to treat. Number 2, make sure you eat a diet that includes lots of vegetables, plenty of fruit, calcium-rich dairy products, and lean protein to reduce your risk. Don't eat too much red meat and processed meat. Number 3, change your lifestyle and be physically active. Don't sit in one place for too long. Try to be more active, especially if you spend most of your working days sitting down. Number 4, limit your alcohol intake or don't drink at all. Number 5, there are medications that can reduce the risk of breast cancer. If you are so concerned, you can discuss this with your doctor, but keep in mind that these medications have side effects. Number 6, work on your weight. If you don't lose weight now, at some stage it will be difficult to get your weight back down. If you are overweight and obese, please try to control it. Number 7, if you have a baby, please, you understand, breastfeed. Breastfeeding could play a role in preventing breast cancer. It also depends on how long you breastfeed. Number 8, limit hormone therapy after menopause. Talk to your doctor about the risks and benefits of hormone therapy. You may be able to manage your symptoms with treatments and medications that do not use hormones. If the short-term hormone therapy outweighs the risks, take the lowest amount that works for you, but that's for you and your doctor to decide. Number 9, quit. You understand? Quit smoking and avoid secondhand smoke. Number 10, get a good night's sleep and limit back-to-back night shifts. I know you need the money, but remember that if your health fails, you will end up using up all the money you saved on treatment. So please cut down on the night shift. Constant night shift is not good for you. And the last point is limiting exposure to harsh chemicals and avoiding long-term exposure to radiation. It is no secret that the choices we make can have an impact on our health. So please take good care of yourself. I hope you put the tips I have given you into practice to reduce your risk of breast cancer. If you have any health concerns, please consult your doctor. If you have any questions or comments, please feel free to leave them below. Thank you and